Michelle, you talked about knowing your numbers, and very important to have those screenings so that we can have the prevention in the long run. Really, we also strive for individuals to be wise healthcare consumers and appropriate use of medical services. So tell us a little bit about the difference with maybe going to an acute care setting or an urgent care setting versus the emergency department.
Well, that goes back to having that healthcare provider. You know, if you have the stuffy nose, you've not been feeling quite well, you know, getting that appointment with whoever your family care provider is. Now, there are often times that our schedules are just crazy and we don't have time to get into the doctor, or the doctor doesn't have an appointment, and that's when it's an appropriate setting to go to an urgent care center. And we've got two of those here in the community, one up in Radcliffe and one down here in E-Town. But that is more for things that are non-life-threatening, like even if you break a bone, you need to get an x-ray, you can definitely go to an urgent care center for that. You might need to get stitches. It's not something that's life-threatening. And I never forget when I've heard David Gray speak to many people that when do you know when you need to go to the emergency department? It's the more horizontal you might be is when you need to go to the emergency department. So 9 times out of 10, if you can walk around, kind of see what's going on and not bleeding profusely, that's a great time to go and utilize our urgent care centers. They're open after hours. Now the emergency department, and I know that we've gotten lots of complaints in the past about people, you know, having to wait long periods of time. Well, under federal law, we can't turn any patient away. So if you have people who are coming in and using the emergency department like a doctor's office, those people have to be seen as well. Obviously, we take more of the more emergent or life-threatening injuries and illnesses first. So it's not whoever gets there gets seen first. And I think that's really where it goes back. If we can try to divert most and more of the life-threatening injuries and illnesses to our emergency department, that utilization and time will be better spent on those patients versus having patients who really don't need to be in that setting. And I think that's where we go back to being a wise healthcare consumer. You know, what specific situation are you having? And I always hear whenever you have an emergency, it's a me emergency, but not always applicable to the emergency department.
And that's so true. And I think being that wise healthcare consumer, and then also seeing if you really can you wait, you know, the 6 hours even though it's midnight, or, you know, 8 hours, and am I feeling okay to partner with my doctor and call in the morning if it's that stuffy nose or sore throat, or is it really the cost difference really from going to the emergency department than going to your family practitioner too? But granted, we do stress that if you're having any medical emergency, you know, that is life-threatening, go to the emergency department. But looking at the cost differences too, and wise use of your healthcare system.
And if you look at the continuum of care, whenever you visit one of our urgent care centers, and you are seen there, and you might have lab work or an x-ray or some various different tests there, or just are there on a visit, and you let them know who your family provider is, they will send that report to your doctor, so then your doctor's office can follow back up with you and make sure that you're doing okay during normal business hours.
Right, and you did stress too, and I think that's important. It is not a substitution for having that partnership with a regular healthcare provider, your physician, your nurse practitioner, whoever it may be.
Right, those urgent care center settings is really for those patients who can't get into their doctor or their doctor's office is closed.
Good point. Now, we've been talking about services. What about all of the medical resources that we have in our community? And I know we have just exploded with a wealth of resources at Hardin Memorial Health, and I'm going to specifically go to our technology here with our computer. Tell us a little bit about what we can find on the www.hmh.net.
Sure. I mean, that website has about 300 pages of content, and we're really, really proud to showcase every single service that we do on that website. So if you're interested in when a service might be open, what their address, phone number, or location may be, need a brochure to figure out a little bit more about what that service might provide, you can go to the website and do that. We also provide ways for people to pay their bills, pre-register for different things, and I think our most commonly viewed section is our newborn nursery.
Well, everybody likes to look at those pictures and the proud moment of having the babies online, and that's a pretty nifty, you know, especially with we talked about too, the relatives that don't live in the area, they may be able to go on there and take a peek too. We talked about finding a provider, and if they go to the website, they click on Find a Provider, it has the different services, and or they could type in possibly the name that they think that last name of that provider and locate their office, and also have the hours on there too, correct?
That's correct. And actually, if you need to print out a full directory of all of our providers, it's very easy. It says print directory at the top. You can print the full directory, or you can pick specific specialties and only print that directory. And we have found that that section of the website is heavily visited as people are trying to figure out the hours of operation or the phone number or address, how to get there.
Locations. Now, and then next to it, I think we have maybe 1 or 2 tabs over the education and wellness. And as we've been talking about wellness this episode, tell us a little bit more about something called HealthLink.
Yeah, last July we added a whole new component to our website, and it's called HealthLink. It has 90,000 health articles, and it's really a neat section because it divides the health content into various different sections, whether it's the healthy living section that may talk about proper eating and wellness and nutrition, even has recipes that break down the nutritional components. There are videos and podcasts and quizzes. I mean, just a wealth of information. And if you don't go through the menu and pick out something, if you're just looking maybe for heart disease or looking for PAD or something along those lines, you can put that in the search box, and then everything that has to deal with that subject will pop up, and then you can just peruse all of the content to find something that might be applicable to your healthcare decision.
And I think the quizzes, that was a very good point, because a lot of times people can do some self-assessments.
Yes.
And then that might spark some conversation between their healthcare professional, hopefully, and themselves, to see what their risk factors might be.
Yeah, the risk assessments is a great thing for people to do, especially before they're going in for that annual exam with their healthcare provider, because they can answer some of their lifestyle choices or some current situations about their health. And then at the end of it, the results page gives you questions that you might want to ask your provider about various different health issues that you might be going through. So if you're one of those people that when you get into the doctor's office, you forget what you were going to say as you were walking in, this is a great tool to be able to walk in, have those questions right there, and to be able to really have that dialogue with your healthcare provider about those specific health topics that are really important to you and your family.
Now, we've talked about HealthLink. There's also something called the Health Connection. Tell us a little bit about how somebody can join the Health Connection.
Well, we've really seen through our website that more and more growth. We have about 20,000 visits a month, and we felt like because the volume was growing so forth there, that it would be good to invest in an electronic newsletter. And people can join Hardin Memorial Health Connection. Off of the homepage, there's a little link there under quick links that says Join HMH Connection. And what this is it's a program where you can go in and tell us what you're interested in, specific attributes, health attributes. There's about 20 of those. And then based on what you put in there, then we send you emails, monthly emails about various different health content that is based on your attributes. And then in addition to that, if we have new physicians that are moving to the area, screenings, special events, anything that Hardin Memorial Health might be doing that might apply to you, then we send that to you via electronic information.
It has great information, and it actually comes to them. It won't flood your inbox, but give you appropriate information, especially about upcoming seminars. You had alluded to our mobile health unit, where we might be out on location for you to come by and take advantage of those health screenings and learn your personal risk factors too.
Yeah, the other thing that I think we're really excited about to watch the growth is our Facebook page. We have about 4,500 people who visit our Facebook page weekly, which is really nice. And what we do daily, if you've not ever been to our Facebook page, is we post a health article up every single day. And it's something that's really relevant to what's going on in our community now. It might be tied to the weather or seasonal allergies. I know last summer, with the heat getting to be so bad and our athletes were out practicing for football, we were posting a lot of information about heat exhaustion and heat stroke. Like with last football season, we posted a lot of information about concussions, because as our sports medicine program was gearing up with their impact testing, there was lots of information out there, but maybe people needed a little bit more. Over Thanksgiving, we posted healthy Thanksgiving recipes that came straight out of HealthLink. So, that's a great resource if you are in the social media kind of connection there, to follow us there. We're not going to bombard you with all kinds of advertisement from the hospital. The goal of that program is to give you good health content so you can be a wise healthcare consumer.
You had mentioned that you get that information. We want to really stress that it does not flood your inbox. It's very concise information. It's very timely too, generally about national health topics and, or as you had said too, what's going on in our community. Now, what about something called Health Matters?
Well, Health Matters is a quarterly newsletter that we've been producing for about the last 4 years, and it goes to about 30,000 households within Meade, Hardin, and LaRue counties. And to sign up for that, you can obviously go to our website and fill out the form to join that. But that newsletter is specific because it deals with health content that the community may be dealing with. It provides information on our screenings. It actually gives information on where the WOW is going to be out at various different activities. And it also showcases some new physicians to our area. For those people who want more of a paper copy in health content, it really serves that purpose.
Michelle, you've given us a great bit of information, and we really want to stress that take the time and visit our website at www.hmh.net. The other great thing is it's not just on the computer, but they can still get that information in the mail with the Health Matters. So a lot of wellness information, a lot of health information pertaining to diseases and common health conditions, but also about our services too. Tell us a little bit about maybe where Hardin Memorial Health is headed in the near future.
Yeah, we referenced earlier the strategic planning process and the creation of our new mission and vision. But really there are 3 areas that came out within our strategic planning cycle. And that was one, we needed to improve upon facilities. And we've started doing that with the renovation of the main lobby. And our hope is as an organization to do away with our semi-private rooms and go to all private rooms. And we understand as an organization that this is going to take money in the future and a lot of capital investment. And so I think you'll start to see us talk more about this master facility plan that we're coming out with, of where we might be moving services within the main campus at 913 North Dixie to accommodate private rooms for our patients there. Now this will not happen overnight. This will be a process that takes several years to accomplish, but we feel like to deliver that high quality of care and to meet the expectations of our community in delivering health care, that we have to offer private rooms as an organization.
And we're really making it and looking at making it more user-friendly for individuals, more accessible. Is that correct?
Definitely. I mean, everything from looking at where people park to wayfinding within the organization to ease and access of all of our services throughout the entire Hardin Memorial Health system.
So we're really striving to look at meeting everyone's needs and our patients' needs, and that goes back to our mission that we had said earlier. And tell us a little bit more about that mission.
Well, part of that mission is, exceeding the physical, spiritual, and emotional needs of patients, and a lot of that is recruiting new quality physicians to the community. We recognize that people have choices. Healthcare is full of choices that people have to make. And so in doing that, we've identified several key areas within our service lines that we need to recruit high-quality physicians here to keep patients from having to travel to Louisville, Nashville, or other places to receive care. And it's through that I think you'll see a lot more recruitment activities kind of gearing up. And we're not recruiting like in the next year. We are talking with physicians who are still in school that might be 2, 3, 4, 5 years out from maybe completing their program, because as this is all heated up across the country, everyone's looking for those same types of individuals. And so we're competing on a national level when it comes to securing specialists who can provide high quality care here in our community.
And along with the physicians, I think we need to stress too that we're keeping up with the technological advancements that are taking place too with medicine and making sure that we have those here in our community too.
Yeah, it's surprising as I've traveled throughout the state and talked to other marketing directors within the hospital industry, and we talk about technology. Hardin really has some of the best technology in all of the state. We're oftentimes some of the first hospitals to have the newest and greatest equipment, and I think that's impressive, and the community should be very proud of that we have made the decisions to invest in technology. We've got that compassionate care with your friends and neighbors who are taking care of you at our hospital, and and we have a vision for where we need to go in the future on how to provide what the patient really wants out of their healthcare system.
Well, thank you so much for being here with us, Michelle. I think you've shared with our viewers a great wealth of information regarding Hardin Memorial Health and how the transition has taken place and where we want to go in the near future. We hope you tune in next month for another important edition of Health in the Heartland. And again, we invite you to go to our website at www.hmh.net.